Hi everyone, my name is Diane Mugunga and I'm an MSIT student here at CMU-Africa. As we are still in the month of cancer awareness, I would like to welcome everyone to our special episode today, where I will be talking about the complexity of cancer or breast cancer. And I'm here with Francis. He will be talking more about the insight and personal experience, which is he has experience to cancer and a big taking it through the causes and effect of breast cancer. You're welcome, Francis.
Thank you, Diane.
Hello, Francis. Can you briefly explain your personal experience to breast cancer and how it has impacted your life?
Hello, my name is Yuyun Francis, and I'm an MSIT student here at Carnegie Mellon University, Africa. So, breast cancer has touched me on a personal note because I lost my sister a day after accepting admission to be here at Carnegie Mellon University. It was really very difficult for me to make a decision either to come or not to come, but I had to make a decision, and I chose to be at Carnegie Mellon not because I didn't value my sister, but she was gone, and it was a very painful experience for myself and my family. So breast cancer, it's actually nobody's friend. After my sister had gone through a series of chemo and everything, she was really deformed. Chemo had dealt with her, and it was really sad. And looking at her, I met her a week before she passed away. To be honest, I didn't realize who she was, the pain she was going through. But one thing that kept me active was because she was always smiling. So after her death, I decided to use this, to take that as an opportunity to fight against cancer, to fight against breast cancer in any way I can. So yeah, so thank you, Diane.
Thank you very much for sharing that. It's really hard to understand, and I'm so sorry for your loss. I hope your sister is as well.
Thank you.
And after sharing your personal experience, what do you think might have caused your sister to have cancer, breast cancer specifically?
Well, breast cancer doesn't really have a particular cause, but it has risk factors. Yes. So after my sister passed away, I've been trying to do a little bit of research on that. Yeah, I realized two major risk factors of breast cancer, which is there's a genetic part of the risk factors, and there is environmental and lifestyle. So the genetics part is more of the gender and females, because females are at high risk of getting breast cancer. Not forgetting men too, they are at risk, but females are at higher risk. There is what we call there's also menopause, older when you're getting older. So as older women are more at risk to getting breast cancer. There are also factors like early menstruation. You know, females getting starting their menstruation very early before the age of 12 tend to have high risk of breast cancer. Then there is a family history. So either your grandparents or somebody in your family might have had this disease. Yeah, it's one of the causes that can lead to one of the things that can lead to you having breast cancer. Then for the environmental part, there are a series of that, like alcohol. I mean, lifestyle is very important. So when you consume a lot of alcohol as a woman or even as a man, there are those chances of you getting breast cancer. There is, yeah, I would say there's also diet. You know, when you're not living a healthy diet, lifestyle, there are other activities that are advised to do as females to avoid these kind of things, like you need to have regular sports, all of those things. So your lifestyle and matters a lot when it comes to you preventing yourself from getting breast cancer. Also, regular checkups are very important for that, because females at times they neglect this, so there's negligence in part of that, which I believe can be avoided if you take your life seriously. If you take as a point of doing your regular self checks, you're going to make sure you cut this part of getting yourself to exposing yourself to breast cancer. But breast cancer is actually one of the number one killer of cancer in African women today, and all of these factors are they're very important, and everybody's called to look out for them and to take them very seriously. Yeah, thank you, Jen.
All right, thank you very much for sharing. And I would like you to take us through what are the effects, like big effects you've seen, like you have experienced the personal experience with your sister, and what are the effects, big effects that somebody can have after having cancer, and how can you advise people who have cancer already, how can they behave, how can they treat themselves?
Okay, there is this stigmatization we have as humans, not just ladies. Like you are scared to talk about your illness. Like for example, there are people who have breast cancer, but they are shy, or people who have issues with their breasts. They tend to be shy for like not talking about it. But you can, when you go for consultation, you don't tell the doctor you have problem with your breast, or maybe you are scared to. For that stigmatization, we need to remove that. That's one of the things we need to remove. We need to educate our children. We need to educate our ladies to know that it's okay to talk about your breast health. It's okay to talk about those parts of your body you feel like people shy away from talking about their reproductive parts when they are going for health consultation and all of those things. In the African context, it's more of how we are brought up. It's more of like the culture we see like a taboo, which is something we need to remove, that stigmatization, because the effects you get, because when cancer has grown to a very to the stage which is not curable, no matter what you do, even if you go through chemo, even if you go through therapy, you're still going to die. So that's the advice I'll give every female. Make sure you are able, allow yourself to talk about your health. Go for your self checks. Make sure you do regular checkups. It's okay if you discover it's early. It's better detected early, which increases your chance, your survival chance to 100%. Than detected late, your chances drop to almost 25% of surviving. So, yeah. So I believe the most important thing is the stigmatization of that we need to take away from our minds.
All right,
Yeah.
thank you very much. We have some people who have already given up to their lives because they have cancer at the high level stage of cancer. What can you tell them now?
Okay, I mean, you don't give up. It's difficult to say you would survive, but the truth is you need to be strong, because cancer at a very high stage at times we know you're going to pass away, because no matter what they do. Because my sister, after going through chemo, we spent a lot of money. She went to different hospitals. She had finished her therapy, but now, and she was always smiling. That's the irony. You could never know she was down. And 1 week later, she gave up the ghost. And that's something we need to live with. Those who are already living with cancer and at very high stages, it's a very difficult moment, but they need support. What they need now is for us to always encourage them, be with them, love them. Yeah, like yesterday we attended the cancer walk. Yeah, I mean, there was a question, why do you walk? So I believe all of us should take that away with us. Why today? Why do you make a walk? When you take each step of the way, ask yourself, what am I doing to change the narrative of cancer? What am I putting in place to help people overcome this cancer stigmatization? What am I doing to bring out innovative ways? Not because Africans, we realize that we don't have the breast cancer compared to the Western world, but they manage it better than us, and it's due is the fact that we don't want to accept what is happening and take up as a task to fight against this disease. So I encourage every African today that when you take each step every day, ask yourself, why do I walk? Why am I taking this step? What am I doing to change the narratives that us Africans here we have? What am I doing to, yeah. So those who already live with cancer, I just want them to know we are here with them, we're supporting them, we're working with them every step of the way, and it's not the end of the world, but we are here to support and help them live with the cancer as normal humans. Yeah.
Thank you very much, and thank you very much everyone for watching. We encourage everyone to take care and support whoever is going through cancer and their families, and remember, early detection can make a very big impact to our lives. Thank you very much for watching. Thank you, Francis, for coming.
Thank you, Diane, for having me, and thank you all for watching, and hope to see you soon. And we're inviting you all for a breast cancer campaign here at Carnegie Mellon University on the 27th of October at 3 p.m. So we're going to have a series of activities to help you walk through your cancer journey, so that through the end month of this October, while you're ending your month of October, you would end it having gained something valuable that will help you live with it and improve your life. Thank you very much. Thank you.